Greetings, it's New Zealand naturopath Eric Backer, author of CanXida Crusher and developer of the CanXida range of Candida yeast infection products. The question today is, Eric, can your antifungal product CanXida Remove, can it be used by pregnant women or breastfeeding women? This is a good question, and I'm glad that I'm making this video because I've just recently got asked this once again in an email. I get this question asked quite regularly, so it's quite good to do a video on it. I'm not really a big fan of treating women when it comes to antifungal treatment, particularly when they're pregnant, especially in the first trimester. So it's not a good idea, right? In fact, I err on the side of caution and don't like any dietary supplements given to women in any stages of pregnancy. There's a lot of talk about giving folic acid to prevent neural tube defects for women, for example. Huge amount of talk. But a lot of this talk is stupid and nonsense. If the woman has a very good diet and she's eating plenty of high folate foods, she won't need to take any dietary supplements. So lots of pharmaceutical companies now jump on the bandwagon and make multivitamins for women that are pregnant to cash in on this sort of lucrative market. But you don't really need to take dietary supplements when you're pregnant. You need to have a very good diet. It makes sense, okay? Low stress, no alcohol, no tobacco, good food, plenty of rest, plenty of water, and the body will take care of itself. And I also get asked, can I go on a detoxification now that I'm pregnant or breastfeeding? No, you can't. You do not stir up toxins in the body with pregnancy or breastfeeding. You're best to do that as a preparatory before you get pregnant. Do it well beforehand. Do the detoxification. If you've got Candida, treat it before you get pregnant and try and eradicate it or get it to a low point. There's no point having a big flare-up during pregnancy and then trying to treat it. Because a lot of the herbs that we use, if you look at CanXida Remove, for example, there are different herbs in there which I don't really recommend that you take during pregnancy. All right, it's not a great idea. So you can treat Candida symptomatically, though. You can treat the symptoms. You can do douches and washing, for example, with vaginal infection. They're not a problem, but you don't want to go heavy duty with those treatments either. Once you get into the third trimester, particularly the latter stages of the second trimester and the third trimester of pregnancy, it's a lot safer, I believe, to treat than it is in the first trimester. But with breastfeeding, again, it's not a good idea because what goes in the mouth will come out the breast. So, you could end up with problems with the baby. In some situations, it's actually beneficial for you to treat and take some supplements internally if the baby's got oral thrush. But in most cases, it's not really warranted, so I don't really recommend you do that. The baby can be treated homeopathically. There are different treatments we can recommend really for the baby for oral thrush. Probiotics is usually a very good idea. You can safely take probiotics during pregnancy. But antifungals, not really a good idea. I just think err on the side of caution. Particularly if it's your first child, you really don't want to, do anything that could give you the slightest possible risk for losing that child, right? Again, focus on eating the right kind of foods. There's no reason why you can't have coconut milk products, for example. Increase your intake of garlic, oregano. These sort of things are good antifungal dietary measures. So that's not a problem. But just be very careful about people offering advice for you to take antifungals during pregnancy. I would recommend no, don't do it. It's only a 9-month stretch. Wait till you come out, then we can start thinking about treatment. All right? It just makes more sense to me. So I hope that answers your question. Thank you for tuning in.